Approved use. UZEDY, risperidone, extended-release injectable suspension, is a prescription medicine used in adults for the treatment of schizophrenia. Important safety information. What is the most important information I should know about UZEDY? UZEDY can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. UZEDY is not approved for use in patients with dementia-related psychosis. Do not receive UZEDY if you are allergic to risperidone, paliperidone, or any of its components. Please see the full prescribing information for UZEDY, risperidone, including boxed warning, on this site. We will discuss additional safety information later in this video.
I'm so proud of you.
Thank you.
Truly. You're amazing. Hi, I'm Dr. Tracy. I'm a nurse practitioner based in Texas. I've owned my own practice since 2015, and I started a nonprofit in 2020. Most importantly, I'm a mom and a care partner to my daughter, Donika. She motivates everything I do.
I'm Donika. I usually go by Nika. I love spending time outside, listening to music, going for walks. Around the time I was 18 years old, I started experiencing some symptoms that told me something wasn't right. I had paranoia, hallucinations, and it scared me. But my mom was there for me. She's been my biggest supporter through it all.
When she was a kid, Nika was a star child, the honor student, a daredevil, and a risk taker. Looking back, there were some early warning signs, but we didn't realize them at the time. When Nika started having symptoms, the main challenge we faced was conversations with her providers. They said she only had substance use disorder, and this likely caused her psychosis. I explained our family history of mental illness, but they still didn't listen.
When I first started having symptoms, I was feeling trapped in the mind, isolated, and a fear of being in a crowd of people, and just holding back a lot of things that should be said and done with myself towards others. I was feeling paranoid, like someone was against me, or all the attention was on me. I would be walking down the road and see traffic and think the traffic's just for me.
But Nika is such a survivor. She's been on the streets. She's been hospitalized multiple times, too many times to count.
And I've tried a lot of different treatments. I started with daily medications. They helped clear my mind, but it was hard to remember to take the pills. I would put my effort into taking them every day at first, but then I got off track a little bit, thinking everything's gonna be fine because I feel better now. But the more longer I stayed off of them, the more the symptoms had arose.
We switched Nika to a long-acting injectable, but the one she tried wasn't right for her. Then one day, a sales rep came to my office and told me about UZEDY. It treats adults living with schizophrenia. She started explaining to me about the prevention of relapse and all the different things. And I remember the one thing that stood out to me was the size of the needle. And I remember one of the major complaints from Nika was, I don't want them coming at me with that big needle. And so I can say that was a big draw for me, the needle size, but also the word relapse, right? Because we had multiple relapses with substances. So, at this time that word again, relapse, really stood out because that's had been the bane of our existence. Since then, Nika's had some symptom relief. She's not as impulsive. We can connect more. We can celebrate birthdays, play board games. It's like I have my own Nika back. It's not that everything's perfect. She still has hallucinations and paranoia from time to time, but she's able to stop herself and think, maybe I shouldn't be doing that.
When I first started taking UZEDY, at first I was coming at it excited because I didn't have to take the pills anymore. And I could feel my symptoms coming and going, but in a better state of mind. After I had started taking UZEDY for a while, I felt better. And I felt more calm, more peaceful in the mind. I don't feel like I had to isolate myself. We're able to bond more as a family.
One thing I haven't mentioned through this whole thing, and it really hit me, is I know people say things like, well, we don't see her older daughter in the picture, because, why is she not in the pictures when all of her other kids are in the pictures, painting me as this person that I excluded my daughter. And that wasn't the case. And so to have her in those pictures, that means the world.
I want to tell people in my situation to have faith in God, in treatment, and in yourself, and to pray every day. Learn what you can control and what you can't control.
I would tell other care partners, don't be afraid to ask questions and do what you have to do for the person you love. Give yourself grace and find people you can confide in. Learn all the options too. Long-acting injectables are an opportunity, not a punishment. It's not like, oh, you're not taking your pills, we have to put you on the shot. It's, hey, I know it can be hard to take a daily pill. Here's another option.
Once I realized UZEDY was helping, I knew I wouldn't forget my shots. I'm just so grateful we found it.
Me too. Keep going. It does get better. There are bad days, but better days do come.
Yeah.
UZEDY may cause serious side effects, including stroke in elderly people, cerebrovascular problems that can lead to death, neuroleptic malignant syndrome, NMS. NMS is a rare but very serious problem that can lead to death. Seek medical attention right away if you have any of these symptoms: high fever, severe muscle stiffness, confusion, sweating, irregular heartbeat, fast heart rate, or changes in your blood pressure, uncontrolled facial or body movements, tardive dyskinesia that may not go away even if you stop receiving UZEDY. Tardive dyskinesia may also start after you stop receiving UZEDY. Problems with your metabolism that may include high blood sugar, hyperglycemia, diabetes mellitus, changes in the fat levels in your blood, dyslipidemia, and weight gain. Extremely high blood sugar can lead to coma or death. If you have diabetes or are at risk for diabetes, for example, obesity, family history of diabetes, your healthcare provider should check your blood sugar before you start and during treatment with UZEDY. Call your healthcare provider if you have symptoms of high blood sugar, including feeling very thirsty, hungry, sick to your stomach, weak or tired, or confused, needing to urinate more than usual, or your breath smells fruity. High levels of prolactin in your blood. UZEDY may cause a rise in the blood levels of a hormone called prolactin that may cause side effects, including missed menstrual periods, decreased fertility in women, leakage of milk from the breasts, development of breasts in men, or problems with erection, decreased blood pressure, orthostatic hypotension. You may feel lightheaded or faint when you rise too quickly from a sitting or lying position. Falls. Antipsychotic medicines, like UZEDY, may cause drowsiness or dizziness when you are standing, which could increase your risk for falls and related injuries. Low white blood cell count. Problems thinking clearly and moving your body. Do not drive, operate machinery, or do other dangerous activities until you know how UZEDY affects you. Seizures, convulsions, difficulty swallowing that can cause food or liquid to get into your lungs. Prolonged or painful erection lasting more than 4 hours. Call your healthcare provider or go to your nearest emergency room right away if you have an erection that lasts more than 4 hours. Problems with control of your body temperature, too high or too low. Avoid getting overheated or dehydrated. The most common side effects of risperidone included slow movements, stiffness, shaking, restlessness, abnormal muscle contractions or movements, drowsiness, dizziness, anxiety, blurred vision, nausea, vomiting, indigestion, diarrhea, increased saliva, constipation, dry mouth, increased appetite, weight gain, tiredness, rash, and common cold symptoms. Injection site reactions including a lump or itching were reported with UZEDY. These are not all the possible side effects of UZEDY. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. For more information, ask your healthcare provider or pharmacist. Do not drink alcohol during treatment with UZEDY. Before receiving UZEDY, tell your healthcare provider about all your medical conditions, including if you have had neuroleptic malignant syndrome, have or have had uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia, have diabetes or have a family history of diabetes, have had dizziness or fainting or are being treated for high blood pressure, have had a low white blood cell count, have or have had seizures or epilepsy, are pregnant or plan to become pregnant during treatment with UZEDY. It is not known if UZEDY will harm your unborn baby. Use of UZEDY during the 3rd trimester of pregnancy may cause side effects in the newborn infant, including agitation, abnormal muscle tone, tremor, drowsiness, difficulty feeding, and difficulty breathing. Seek medical attention if you notice these signs. If you become pregnant during treatment with UZEDY, talk to your healthcare provider about registering with the National Pregnancy Registry for atypical antipsychotics, or call 1-866-961-2388, or visit http://womensmentalhealth.org/clinical-and-research-programs/pregnancy registry/. Are breastfeeding or plan to breastfeed? If you are receiving UZEDY and are breastfeeding, monitor your infant for sleepiness, inadequate weight gain, jitteriness, tremors, and abnormal muscle movements. Seek medical care if you notice these signs. Have or have had kidney or liver problems. Tell your healthcare provider about all the medicines you take or plan to take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. UZEDY and other medicines may affect each other. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information about UZEDY, see the full prescribing information, including boxed warning, at uzedy.com, or talk to your healthcare provider.